Hello, my name is Sarah Allred. I am a respiratory therapist and a trainer with Neonatal Rescue. This video will provide Neonatal Rescue's protocols and escalation for the NeoLife ventilator. We begin by taking a look at the protocol for placing a baby on mechanical ventilation. It is important to note that prior to placing a neonate on mechanical ventilation, they should first be given basic newborn care and receive any necessary resuscitation efforts. Mechanical ventilation should be considered if the baby has been on CPAP of 8 centimeters water pressure or greater for more than 3 hours, or if the baby is unable to breathe on their own. To begin, the healthcare provider should calculate the neonate's respiratory distress score. More information about the respiratory distress score can be found in the references provided in this module. If the calculated score is not greater than 3, the neonate should be monitored and weaning may be considered for their current therapy. If the score is greater than 3, mechanical ventilation should be initiated with the device in ventilation mode. When using the NeoLife ventilator, mechanical ventilation is delivered using measured pressures. When initiating the therapy, the peak inspiratory pressure, or PIP, should be set between 18 and 25 centimeters water pressure. The amount of PIP set will determine the size of the breath delivered. Setting the PIP higher will deliver a larger breath, while setting the PIP lower will deliver a smaller breath. The positive end expiratory pressure, or PEEP, should be set between 5 to 8 centimeters water pressure. The PEEP is pressure that remains in the lungs to help them stay expanded while the baby is exhaling. Incorporating low amounts of PEEP with mechanical ventilation helps to improve oxygenation. However, it is important to note that high levels of PEEP can decrease cardiac output. The respiratory rate should be set between 25 and 40 breaths per minute. It is recommended to set the inspiratory time, or I time, between 0.35 and 0.4 seconds. A general rule when setting inspiratory time is to coordinate the length of inhalation with the gestational age. For example, a baby born at 36 weeks gestation would receive an I time of 0.36 seconds. The flow should be set at 15 liters per minute. This flow may be provided by the internal pump or by connecting medical air and oxygen to the ventilator. After initially placing the baby on the ventilator, the healthcare provider should continue to monitor them every 15 minutes. The neonatal assessment should include checking the vital signs, calculating the respiratory distress score, listening to breath sounds, and checking color and perfusion. If the respiratory distress score is below 3, the healthcare provider may consider weaning. If after 24 hours the respiratory distress score remains greater than 3, the medical team should consider transporting the baby to a facility that offers higher acuity of care. Thank you for joining us for this video on the NeoLife ventilator protocol and escalation. Please email us your questions at training@neonatalrescue.org.